Hi, Dave with Align Therapy here. I thought I would bring my wife in and torture her for a YouTube video. This is Dionne. Say hi, Dionne. She's going to watch a video while we're doing this to distract her because we're going to do some shockwave therapy. Shockwave therapy is a way to get energy into the tissue for chronic tendon problems. And Dionne has a chronic tendon problem. She has had plantar fasciitis for, what, 3-4 years? Something like that? And so 3 to 4 years she's had plantar fasciitis, and it hasn't, we've done ASTYM, we've done dry needling, we've done a lot of stuff. But we've done 2 treatments of shockwave, and she, what would you say, 90% better? 80 to 90% better is how she's feeling. So pretty amazing. It's actually really cool. Plantar fasciitis is one of the things that's kind of frustrating for us as therapists, but this seems great. So the way that shockwave works, I'll kind of talk about it while I'm doing this, but it's putting pulses and vibrations into the tissue to activate the healing response. So I'm going to use this one first for vibration. We're just going to go around her leg, and so it vibrates through and creates some stimulation to the tissue. We get good blood flow with this. This isn't necessarily shockwave, this is just vibration. We get relaxation of the muscle. We get a less tone of the muscle. It's a good way to start the shockwave treatment to just get things to loosen up. So we're going through the whole calf. I know this isn't where she has plantar fasciitis, but if we just treat the area of the plantar fasciitis, we don't have as good of a result. So we want to work up the chain, we want to work down the chain, we want to work all over in the chain. The chain meaning the muscles that all attach and influence the plantar fascia. And we get much better results if we treat the whole thing. So the way this machine works, this is a machine from Stores Medical called a Curamedics machine. It's a radial shockwave therapy machine. It's pretty cool. It actually counts how many vibrations and how many shocks we do to the tissue. Perfect. So with the shocks, it's not a shock like an electrical shock. It's actually a shock like an impact shock. So with this vibration one, we're not really having that impact shock as much as the vibration, but when we get to the other one, we use a different tool to impact the tissue. So usually, like, Dionne doesn't really mind this that much. This is kind of a massage, and again, we're just hitting all those tissues that correlate to where she has pain and those things that attach to it. So go a little bit longer with this before we get to the fun part. But I don't hold it in one spot because I want to stimulate a lot of other tissues. We put ultrasound gel on her skin so that the tool glides over her skin rather than sticking or causing any irritation. You may have seen something like this in physical therapy before called ultrasound. And ultrasound, unfortunately, wasn't as effective as we thought back in the day. And we don't actually use ultrasound here in this clinic anymore. But ultrasound is trying to send sound waves through the tissue to heat up the tissue. With this, we're not trying to heat up the tissue, we're trying to stimulate the tissue as much as we can to get it to heal. So this vibration is pretty comfortable. It doesn't stimulate the tissue as much as what we're going to do next. So next, we are going to just swap out this head real quick. So the smaller the head on this tool, the more focused the shockwave vibrations are going to be. So we're going to go with this. I can dial in how much energy I want to send into the tissue. So this energy here, and then it also counts how many times, how many hits it does. So we're gonna do 4,000. The way this works is there's a little bullet inside, and the machine throws the bullet against the metal head here, and that creates the shock wave that then goes into the tissue. So that's the shock wave, and as that bullet hits, it hits with pretty good intensity, and that's what we're changing here based on the person's tolerance. And so we're going to go in some different trigger points on Dionne's calf. You can see she has some bruises from last time, but so we turn that on. It sounds kind of like a mini little jackhammer. Dionne has that. She says it's good, which means I need to turn it up a little bit. So we're going to go here. So that ratcheting sound, or the jackhammering sound, is that bullet hitting the end of the tool and then sending that shock wave into the tissue. So as it sends that into the tissue, energy is transferred from the tool to the tissue that we're trying to treat. So we go in different spots with this. I'm just trying to hit a few different trigger points, but over and over it hits, and sends a lot of energy into the tissue. So we're going to keep doing this while I talk about what's going on. With chronic problems like plantar fasciitis, I hope you can hear me, by the way, because it's a little bit loud. With chronic problems like plantar fasciitis, the body almost stops trying to heal the tissue. And when it stops trying to heal the tissue, we get chronic problems. We get little injuries that just don't resolve. They don't finish the healing process. So what we try to do with like ASTYM and with other techniques like dry needling and massage and deep tissue stuff is we try and stimulate the body to heal that tissue. Sometimes it works fantastic. I've used ASTYM for a long time, and ASTYM is a great way to do that, to stimulate the body's healing response. Sometimes though, like with plantar fasciitis, it doesn't quite stimulate it enough to heal the tissue. Like we can get some stimulation of the tissue, but there we go. I'm going to raise her up a little bit. We can get some stimulation of the tissue, but it's not enough to really heal the tissue all the way. So that's why I bought a Shockwave machine, because this can stimulate the tissue more than I can with ASTYM. A little more direct. It creates a little more soreness, I'd say, the next day and later that day. But usually, for a few hours, it actually feels pretty good because we've stimulated the nerves, we've reduced the inflammatory mediators a little bit, and it usually feels pretty good. And I think that was Dionne's response too. A couple hours she felt pretty good, and then she was kind of sore later that day. So that soreness is your body's natural healing response. A lot of people call it inflammation, the inflammatory response, but we need that response to actually heal the tissue. So if we can heal the tissue, if we can kick up the inflammatory response and control it, then we can, oh, that's a little much. She's just complaining now. So it's a little more sensitive on the bottom of the foot. So that's why it has to be like a 4 or 5 out of 10 discomfort level, because why would our body heal a tissue that just feels good, where there's no stimulation for the body to send in the troops and heal the tissue? So that's why it has to be a little uncomfortable to get to that point. I mean, plantar fasciitis is uncomfortable anyway. You okay? Too much? Take it down a little bit. But if we can go through some discomfort for 15 minutes once a week for 3 to 5 weeks, then it's worth it. At least in my opinion. I don't know, you should talk to Dionne tomorrow morning when she goes to stand up instead. So just trying to hit some different spots. And again, it was counting down those hits, the, what do they call it, the pulses. So that was quite a few pulses. Very enjoyable experience, right? Just kidding. It's not a crazy enjoyable experience. So we're going to switch to a different head here that's smaller. The smaller we go, the more focused the shock waves are. So we're going to go right to the area of the problem. And that would be right here. Usually plantar fasciitis is right on the inside of the heel right here. So that's where we're going to focus on. That's where the plantar fascia comes up and attaches into the heel. So this one's usually a little more uncomfortable. But we're going right around there. How's that, Dionne? This one's a little louder, so I don't know if you can hear me as well, so I won't say anything important while we're doing this one. But we're just trying to go right around where that plantar fascia attaches. So going around. So that's Shockwave for plantar fasciitis. I think that's going to be one of the main things that we use it for at first, because it's such a struggle sometimes with plantar fasciitis. It's not the most comfortable treatment, but the results kind of speak for themselves at this point. 2 treatments and Dionne is doing fantastic. So if you have questions on Shockwave, feel free to give us a call, shoot me an email, subscribe to the channel. I'll show some other Shockwave treatments on different things, and we'll see which things it works the best for, which things it might not work as well for, but I think it's going to be great. And thanks for watching. Don't forget to hit subscribe, and we'll see you later.